Today, Mayor Emanuel and I are proud to announce the findings of the City-County Collaborative we announced on March 29th. We asked 7 committee members to work together to identify ways to reduce costs, streamline interactions with residents, and provide better services. I want to thank our committee members, Gloria Castillo from Chicago United, my former colleague, Alderman Pat Dowell of the 3rd Ward in the City of Chicago, Commissioner John Fritchie of the 12th District of the Cook County Board of Commissioners, Ralph G. Moore and Associates, Jorge Ramirez, the Chicago Federation of Labor, Juan Salgado of the Instituto del Progreso Latino, and Paula Wolf from Metropolis Strategies. We also want to recognize the considerable pro bono work that supported these efforts. Thanks to our pro bono team members from the Civic Consulting Alliance, Schiff Hardin, and Alvarez and Massal, and to Accenture and Mayor Brown, both of which provided pro bono research support. While our 2 governments share a building, an effort to work together at this level is unprecedented. Together, the county and the city can provide better services than either could alone. On my first day in office, I laid out 4 principles by which we would measure our administration: fiscal responsibility, innovative leadership, transparency and accountability, and improved services. I know the mayor and our committee members share these goals, and the report shows this. In just 2 months, the committee has already identified $66 to $140 million in annual savings opportunities and numerous opportunities to improve the quality of service. Examples of cost-saving measures include consolidating maintenance crews within the city-county building, pursuing a shared approach to how we purchase electricity and natural gas, as well as joint purchasing of such items as salt in the winter. We're both committed to pursuing joint purchasing on select upcoming bids, and will hold regular Chief Financial Officer and Chief Procurement Officer meetings to begin to identify immediate savings. Since passing our open data ordinance on May 3rd, and I want to acknowledge Commissioner Fritchie's good work on this, we have been committed to increasing the transparency and accessibility of information within the county. With a commitment to sharing 311 geographic data and other information technology, our websites will be faster, your records will be easier to find, and callers to the county will have 24-hour, 7-day-a-week operators, as they already do in the city. One area that has raised questions as we announce these initiatives is health care. Roughly 1/3 of our county's $3.1 billion budget goes to health care. The Chicago Department of Public Health has a budget of $187 million and employs nearly 1,000 people. In several neighborhoods, the city and the county operate clinical facilities which are within blocks of each other. Immediate collaboration should be reflected in the 2012 budgets. For the immediate collaboration, the city's Department of Public Health and our Cook County Health and Hospital System personnel would evaluate and implement shared pharmacy and mammography services and a pilot program to operate a shared clinic. A unified healthcare system will mean suburban women needing mammography screening can use city clinics for the first time, which have extra capacity today. It means that patients in city clinics can use the county's automated prescription system to fill their prescriptions more effectively. However, the broader issue of the future provision of public health services in the region demands additional in-depth study. The long-term regional coordination will require a panel. The panel appointed by the mayor and the county president should include representatives from throughout the region, private and public sectors, community leaders and residents, nonprofits, and health professionals. The panel should be convened immediately and should be given 6 months to produce their recommendations. These recommendations should be included in our 2013 budgets.
As the President noted, in the area of healthcare collaboration, coordination, and better services, we need further work. Given the 2 budgets reflective, as noted by the President, there's more resources to be found, inefficiencies and efficiencies to be found, and better coordination of service delivery to be found. And we've asked everybody to continue their work. In addition to that, since you did so well, we're not letting you go. And you're going to continue actually to what I hope will be holding all of us accountable to see the $140 million in savings through. Now that's the potential. Somewhere, as the President said, between $65 to $140 million in savings. And as I said, and the President said in our own respective transition reports, here are our goals. Here is what we think we can accomplish. I want this group that worked well together to continue to stay and monitor and help innovate ideas to greater collaboration. Now, the two governments are just a hallway apart. Yet for too long, for the taxpayers we both collectively represent and are accountable to, we have not done the best job. These hallways have been miles apart, rather than just a few feet apart. And that is when you're buying services, and that is through procurement, or in actually putting out bids on other services. Through collaboration, we can both save the taxpayers money and get them better services. And we have an obligation in these tight budget times, reflected in both of our respective governments, to do a better job for the taxpayers. Now, I did say, as we said it on March 29th, many of these studies have been done before. They have not been initiated by either the mayor or the president jointly. And that is why I think this will be different. So I do not want, and I know the president shares this because we met Friday when we went through the report together. This is not another report to just gain dust sitting on the bookshelf. This is a report that now our respective departments, be they in revenue, procurement, chief financial officer, budget, transportation, healthcare, where we need more work, we said, job training. We need all of those directors and respective agencies and departments to work together, realize the savings in places like revenue, where the city's ahead and better. We'll take a lead. In areas of procurement where we both have good directors, we'll work together and have them work together. But we owe it to the taxpayers, we owe it to the people who are dependent on the respective services, from healthcare to criminal justice, to job training, to economic development, to work together and find the efficiencies, the savings, and put those resources to better use as we face tough times. But if we do that, it is my hope, and I think the hope of both the panel as well as the President and myself, that we can then deliver services better to the people we're responsive to and be conscious of the pennies and dollars we spend by having gone through this line by line. So whether it's in the energy area, buying those services together, in cleaning literally the buildings where we share, or in areas like in community health care clinics that we are in the same building, rather than running two separate clinics, they can be done more efficiently. It is those basic ideas that seem common sense require these individuals to come together, deliver us a report, and now both of us are accountable and our department heads are accountable to making sure we realize over the year and the years the $66 to $140 million in savings that are capable of being done. And I want to stress one other thing. Other cities and counties around the country are doing this. What's unique now is the first time now Chicago and Cook County are not having a third party deliver a report, but we've asked for this so we can actually now do what people in the area of Phoenix, Charlotte, North Carolina, they have done, or Indianapolis and their county. We are now going to do here in Chicago and bring that modern, smart, common sense approach to being conscious of the taxpayers' dollars and being held accountable to see those savings through.